myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll talk about the elbow biomechanics. So first we'll talk about the function of the elbow. So there are two major functions of the extremity joint, that are mobility and stability. So the function of elbow joints are to add mobility of the hand in space by shortening and lengthening of the arm, rotating the arm, or the combination of the both. Next is to provide control and stability. It helps for skilled hand motion and for forceful upper extremity motion. Next is joint structure of the elbow. The elbow complex is consist of three joints, that is the joint between the humerus and the radius, that is humeroradial joint between the humerus and the ulna, that is humero-ulnar joint, and there is a joint between the radius and ulna, which is a proximal radio-ulnar joint. And all three joints are enclosed in the same joint capsule. Next is humero-ulnar joint. So proximal components of this joint is hourglass shaped trochlea or trochlea, that is pulley shape. Next is olecranon fossa, and third is coronoid fossa. Coronoid fossa is like crown, and distal component of this, or the distal articular surface of this joint, is ulna. Next, the humero-ulnar joint is a hinge joint, and the motion occurring in this joint is elbow flexion and extension. Elbow flexion with anterior glide of trochlear notch of the ulna on the trochlea of the humerus. Elbow extension with posterior glide of the trochlear notch of the ulna on trochlea of the humerus. And the resting position is 7 and 10 degree of forearm supination, and the degree of freedom in this joint is 1 degree, that is only flexion and extension. And the closed back position of this joint is full elbow extension. So this figure represents the articular surface of the humero-ulnar joint from the posterior view and the anterior view. So from the humerus, this is the trachea, that is capitulum, lateral epicondyle, olecranon fossa, and this is medial epicondyle. This is radial fossa. This is coronoid fossa, where the ulna is attached, epicondyle, trochlea, and the capitula. Thank you.